Again, don't put it down.
It's closer.
Sure. One hour more.
Mhm. Morning, ma'am.
Morning.
Morning. Hi, I'm Vernon. I'm going to be the nurse practitioner student with you today. I'm going to shut the door for your privacy and wash and sanitize my hands. So now that we have some privacy, could I ask your name? Uh-huh. And when were you born?
November 10, 2021.
What is your race?
Asian.
And do you identify as a female?
Yes.
Yes. Okay. So what brings you into the clinic today?
Having some headache, and it's been 2 weeks already.
Okay. So let's go over the history of present illness using the OPQRST. So the onset you said is over 2 weeks ago.
Yes, that's right.
Any provocative factors, anything that makes it worse?
Yeah, lack of sleep, loud noise.
Okay. Any palliative factors, anything make it better?
Yeah, when I take a pill liver like Tylenol.
Okay. Q, the quality of the pain or quantity. Can you describe how the pain feels?
Dull pain, it's on my right side.
Right side of your head, dull pain.
Yes.
Does the pain radiate anywhere?
No.
Down your neck or to your shoulders or chest?
No.
And the severity, when has your headache been at its worst on the pain scale of 0 to 10, and 10 is the worst pain imaginable?
6 or 7.
6 or 7, okay. And then the timing, if you have a headache, how long do they typically last?
If I didn't take any medication, it lasts like 1 to 2 hours. It comes and goes.
Okay. So the chief complaint is a headache for 2 weeks. Along with the history of present illness, we're going to go do a complete head-to-toe physical assessment, which involves several questions. Some of them are personal, but they're all about you and your family. And if at any point you feel uncomfortable, I just ask that you tell me to stop. Along with the questions, we do a hands-on where I assess different areas of the body, starting at your head and working down to your toes. So if at any point you feel uncomfortable, I just ask that you ask me to stop and we'll go from there, okay?
Okay.
I want you to be comfortable as possible.
Thank you.
Okay, sounds good. So with that being said, let's start with your medical history. Do you have any diagnosed chronic diseases?
No.
Any diagnosis at all?
No.
No. Do you have any infectious diseases?
No.
Have you ever had any mental or psychiatric
No.
diseases? No. So with the past medical diseases, chronic diseases, infectious diseases, or mental diseases, I would want to know what year they were diagnosed, any medications that you were taking for those diseases, or any hospitalizations because of these problems. Have you ever had to be hospitalized before?
Yeah, when I give birth,
Okay. One time?
2 times.
Two? So you have two, you gave birth twice?
Yes.
Okay. Have you ever had surgery before?
Yeah, 1 time.
What surgery was that?
C-section in my second child.
Okay, cesarean for the second child. Any complications with that surgery?
No.
No problems with anesthesia that you had?
No.
No. And your first child was a natural birth?
Yeah, normal delivery. Yes.
Oh, okay. Uh, do you have any allergies to medications?
No.
Any allergies to food?
No.
Any seasonal
No.
environmental allergies?
No.
No. Did you get the flu shot
Yeah.
this time?
Yes.
And you're up to date on your COVID vaccinations, including the booster?
Yes.
Are you vaccinated from childhood to now? Are they all up to date?
Yes.
Yes. Okay. And other than your pregnancy and giving birth, you've never had to be hospitalized, right?
That's right.
Okay. When was your last menstrual period?
2 years ago.
2 years ago. So you've been pregnant how many times?
2 times.
Two times, and you have two children.
That's right.
Any miscarriages?
No.
Any abortions?
No.
Do you have any future pregnancy plans?
No.
No. How do you protect yourself against STIs, sexually transmitted infections?
Nothing. Because just it's me and my husband only.
Just you and your husband are the partners? Okay,
Yes.
gotcha. Thank you. That was kind of one of those sensitive questions. Um, let's move on to the family history. So I'm going to ask you about different members of your family. Let's start with your mother. How
Mhm.
old is she? Is she still alive?
Yes. 67 years old.
Okay. Any diagnosed medical problems for mom?
Yeah, she have diabetic,
Mm-hmm.
high blood pressure, high cholesterol, and he have she have a heart enlargement also.
Hmm. Okay. How about your dad? Is he still alive?
Yes,
Okay. How old is dad?
76 years old.
And does dad have any diagnosed medical problems?
Yeah, same with my mom. He had a high cholesterol, diabetes. He
Okay.
had stroke and seizure also. Seizure.
Oh, okay. Sorry to hear that. Your maternal grandparents, so this is your mom's mom and dad. Let's start with your grandpa on your mom's side. Is he alive?
They're all deceased.
Any idea when he passed away? What age?
No idea.
Any diagnosed medical problems?
I don't know. No idea.
For also for your grandma?
That's
Any
right.
idea on the
No
age?
idea.
No diagnosed medical problems?
No.
Okay. Um, paternal, so your dad's mom and dad.
They're all deceased also.
Any idea on the age of death?
No idea.
Any diagnosed medical problems?
No idea.
Gotcha. How about any siblings?
Yeah, I have 2 sisters and 5 brothers.
Two sisters and five brothers. Let's
Yes.
start with your sisters. What are their ages?
50 years old and 42 years old.
How are they doing? Do they have any medical problems?
Yeah, they're good. And they're same with my mom. They both have a heart enlargement.
Heart enlargement?
Yes.
Okay. And then your brothers, what are their ages? You said you had five?
Yes, 48 years old, 46. We just 2 years age gap.
Okay, gotcha. And your brothers, do they have any medical problems?
No,
No, that's good. And your children, two children,
he is
what ages?
3 years old and 8 months old.
Okay. And any medical problems for your children?
No,
No. Good. Um, sounds good. So I'm going to ask you key areas on the review assistance for your family. So this is talking about people I just talked to you about. So neurological, you mentioned dad had seizures and he had a stroke. Is there any other neurological diseases that your family has?
no,
Anybody have any Alzheimer's or dementia?
no,
Anybody ever had a traumatic brain injury?
no,
Anybody have any dizziness,
no,
unexplained falls,
no,
headaches? Any migraine headaches run in the family?
no one.
No. What about any problem with their eyes? Anybody blind? Suffer from blindness,
No,
cataracts,
no,
glaucoma?
no,
What about ears? Anybody deaf in the family?
no,
Any discharge from the ears,
no,
ear pain?
no,
Nose? Anybody have any problems with their nose or sinuses?
no,
Any bleeding nose?
no,
No. Anybody have problems with their mouth? Any sores inside the mouth?
no,
Any gingivitis?
no one.
No. Anybody have problems chewing and swallowing food?
No,
Any problems with their neck? Any notices like of a mass or something sticking out that looks asymmetric?
no,
No. No one's sensitive to the cold or heat.
no one.
And you mentioned mom and dad are diabetics, but any problems with the thyroid,
No,
other endocrine diseases? Okay, no one else has any frequent uncontrollable urination or thirst?
no one.
Okay. How about the heart? It said mom and dad are both high blood pressure and high cholesterol. Your mom has an enlarged heart, as with your sisters. Has anybody had any other heart problems?
No,
No heart attack?
no,
No one has some chest pain, intermittent?
no,
No. Rapid heartbeats or slow heartbeats that you know of?
no,
Okay. What about any problems with the lung? Any chronic lung diseases?
no,
No coughing,
no,
coughing up blood,
no,
shortness of breath,
no,
wheezing?
no,
None of the above. Any lung cancer?
no,
Any cancer of any body system in the entire family history?
no,
No. Good. What about the gastrointestinal tract? Anybody have any problems with digesting food or drinks?
no,
No. Anybody have any diarrhea or constipation?
no,
Anybody ever had a small bowel obstruction or a bowel obstruction?
no,
Colon cancers?
no,
Anybody have any blood in the stools?
no one.
Urinary system? Anybody have any blood in the urine?
No,
Kidney disease?
no,
Frequent UTIs, urinary
no.
tract infections? How about musculoskeletal? Anybody have any problems with their bones, joints, muscles?
Yeah, my daddy has, what do you call it one? Gout,
Okay,
arthritis.
okay. Gout and arthritis. Gotcha.
Yes.
Anybody have any other diseases
No,
with the musculoskeletal? Does anybody have any recent falls?
no,
Okay. What about skin? Anybody have any skin cancer?
no one.
Anybody have like a cut or scrape that won't go away, won't
No.
heal? Notice anybody bruising easily?
No,
Anybody have any bleeding disorders?
no,
Any genetic disorders?
no,
Anybody suffer from obesity in the family?
no,
Anybody have any mental or psychiatric problems?
no,
Anybody addicted to substances,
no,
alcohol or or drug abuse?
No one.
Anybody allergic to anything in the family?
No.
Has anybody in your family had surgery before?
No.
Let's move on to the social history. Where were you born?
Philippines.
What is your ethnicity?
Filipino.
Philippine. And how long have you been in the United States?
5 years.
5 years. Are you married?
Yes.
Okay. So do you live with your husband and children?
Yes.
Where do you live?
The house.
In a house. Any other family members in the house?
No.
No pets?
No.
What's your job?
Stay home mom.
What's your highest level of education?
High school.
What's your nutritional status like?
Balance. I eat fish, veggies, meats.
Fish and veggies and meats.
No.
Good. And then any food restrictions?
No.
Any how's your hydration status? Fluids?
Good. I drink 1 glass coffee every morning and water the rest of the day.
I see. Any laxative use?
No.
When's the last time you used the bathroom?
This morning.
Was the color, what color?
Brown.
Brown, and was it hard or soft?
Soft.
Soft. Okay. Yeah, you military?
No.
And you said you're up to date on all your immunizations and vaccinations from childhood, correct?
That's right.
Okay. What do you do for fun? What's your leisure activities or hobbies?
I do exercise sometimes. Play with kids.
Exercise. How often do you exercise per week?
Twice or thrice a week.
2 or 3 times?
Yes.
What do you do for exercise?
I walk in a treadmill and sometimes we walk outside.
Mm-hmm. Good, good. You, how's your sleep?
Oh,
How do you sleep?
it's okay. It's
Okay.
hard to sleep good when you have a newborn baby.
Mm-hmm.
I sleep
Yeah.
like 5 to 6 hours
I see. On and off.
on and off. Yeah.
Is it so your sleep is disturbed from your children, but not overly stressed or worried about things?
No.
No. No history of violence
No.
or a suicidal ideation?
No.
No, never.
Never.
Yeah, okay. You smoke?
No.
Any alcohol? Drink alcohol?
No.
Any illicit drug use?
Never.
Okay. And you said your last menstrual period was 2 years ago. No pregnancy plans, correct?
That's right.
Let's go ahead and move on to the review of systems. So these questions are pertaining to you. How would you rate your overall health?
Good.
Good. Have you had any, you said you had a headache, but any other things that would go wrong with your neural, including lightheadedness or dizziness?
No.
You often forget things?
No.
No. Uh, any problems with recent changes with your vision?
No.
No blurred vision,
No.
double vision,
No.
any mysterious floaters in your vision, field of view?
No.
No. When was your last eye exam?
Last year?
Do you wear glasses?
No.
No. Um, what about any problems with your ears?
No.
No. Any discharge,
No.
pain,
No.
loss of hearing?
No.
Any problems with your nose? Any runny nose,
No.
bloody nose,
No.
unable to breathe out of your nose,
No.
sinus congestion?
No.
Any problems with your mouth? Any bleeding gums,
No.
dental cavities?
No.
Any problems chewing or swallowing food?
No.
Never coughed or choked?
Never.
Any changes in your skin?
No.
Notice bruising easily?
No.
Any cuts and scrapes taking a longer time to heal?
No.
Any chest pain?
No.
Rapid or slow heartbeats?
No.
Notice any palpitations?
No.
Respiratory, any problems with shortness of breath?
No.
Any cough?
No.
If cough up anything, any sputum production?
No.
No. Any problems with your gastrointestinal system digesting food?
No.
Never had a nausea, vomiting,
No.
and no diarrhea,
No.
constipation,
No.
no abdominal cramping,
No.
no pain, right?
No pain.
Any blood in the stools?
No.
Urinary system, do you have problems urinating,
No.
burning or painful urination,
No.
frequent UTIs,
No.
blood in the urine?
No.
Any problems with the musculoskeletal, any muscle, joint pain, no joint swelling, tenderness?
No.
Do you find that you're very thirsty often?
No.
Find that you have to go to the bathroom urgently, frequent urination?
No.
Do you feel sensitive to cold or the heat?
No.
Okay. So let's go to the general survey. Uh, Patient is sitting relaxed on the exam table. Mood and affect are appropriate. First is alert and oriented person, place, time, and situation. Answers questions appropriately. Good hygiene's noted with no malodors. Smiles appropriately and is in no acute distress. What's your height?
5 foot,
5 foot, and your weight?
115 pounds.
Height and weight. Um, the medical assistant provided me with the results of the vital signs, which includes temperature, blood pressure, heart rate, respirations, oxygen saturation, and a 0 out of 10 pain. And also the results of the Snellen chart, which assessed cranial nerve number 2, which is intact. How you doing throughout the exam? Still comfortable?
Yes.
Okay, good. Let's go ahead and go to the first assessment of the skin, hair, and nails. So the skin is appropriate to race. There are no wounds or rashes. Skin turgor is good with no tinting noted, no swelling and no edema noted.
Swelling.
Patient does have some nevi on the lower neck and upper chest, so I'm going to go ahead and use the A, B, C, D, E method. So the nevi are symmetric, the borders are crisp and clear, color is light brown, diameter is 2 millimeters, and evolution. How long have you had these moles?
Since birth?
Since birth, they're virtually unchanged.
Yes.
So the evolution is they haven't changed, grown, or shrunk in size since birth. Any other areas of concern, I would use that also to check for any melanomas and appropriately address them as macules, papules, or vesicles. There's no clubbing on the nails. The capillary refill is 2 seconds, which is normal. No cyanosis or arrhythmia. Hair is healthy appearing, no lesions or rashes noted on the scalp, and black in color, evenly dispersed throughout the scalp. So this is the part where I'm going to be doing numerous tests, starting from your head, going down to your toes, meaning this is the part where I'm going to physically touch you. I still have your permission
Yes.
to proceed?
Yeah.
So going closer, I'm going to start touching your head, okay?
Yes.
Palpating the head, any tenderness?
No.
Head is normal cephalic, atraumatic. Hair is evenly dispersed throughout the scalp. No patches of hair loss is noted. Hair is healthy, shiny, black in color, and no pain on palpation, right?
No.
Okay. I'm gonna. What about your sinuses here?
Yes.
Maxillary and frontal sinuses. Any pain or tenderness?
No.
Face is symmetric. Skin on the face is intact. No bruising or wounds or rashes are noted. The temporal pulse on the left is patent. Temporal pulse on the right is patent. Carotid on the left. Carotid pulse on the right is patent. Let's go ahead and assess your lymph nodes. So this is the preauricular, postauricular, occipital, tonsillar, submandibular, submental. Anterior cervical, posterior cervical, supraclavicular, infraclavicular. So anterior lymph nodes, axillary lymph nodes, subscapular lymph nodes. Okay? And while I'm doing lymph nodes, I'm going to do the one in the arm here, the epicochlear. Any pain or tenderness on those palpated areas?
No.
Okay, good. Sclera, conjunctiva, iris, and lens are all good. No abnormalities are noted. I'm going to go ahead and proceed with the examination of the eyes. I'm going to shut the light off. So I'm going to test your cardinal 6 views of gaze and assess that you follow the pen light with only your eyes, okay?
Okay.
So cranial nerve 3, oculomotor, 4, trochlear, and 6, abducens is intact. Now I'm going to shine a light in your eyes a couple times. Just look straight ahead, please. Okay. Pupils are equal reactant to light and accommodation. The PERDA. How was that?
Good.
Still doing okay, miss?
Yes, sir.
Good, good. Let's go ahead and move on to the ophthalmoscope exam. It's going to involve another bright light that I shine into the back of your eye to assess the retina and other vessels. Is that okay with you?
Yes.
Okay. So, being level with the patient, I'm going to ask the patient to hold up the left thumb and look directly at the thumb. Shine a light come out from the side. Ready?
Yes, sir.
Okay. Approaching the patient at a 50-degree angle, I located the red reflex. Moving and focusing on the vessel. The disc to cup ratio is 1:3, which is a normal finding. Can you look at me? Visualize the macula and foramen.
Okay.
Yeah, later. I'm going to do the same thing with the other eye. So hold up your right thumb, look directly at it. Again, approach the patient level. Located the red reflex. Moving in closer, following the vessel. The disc to cup ratio is 1:3. Look at me. Look up. Look down. Then look at me again. Visualize the macula and foramen. Still doing okay?
Yes.
And that's a bright light. Thank you.
I'm sleepy.
Yeah. Yee. You're going to go ahead and turn the light back on, okay?
Okay.
Would you close your eyes? Tell me if you smell this.
Yes.
What is it?
Bubble gum. Smell gum.
Peppermint?
Yes.
Good. So cranial nerve number 1, olfactory, is intact. Palpate your jaw open and close. No clicking or popping noted. No TMJ. So cranial nerve number 5, trigeminal, is intact. We're going to go ahead and go to your ears now. So any pain or tenderness on the ear? No ulceration, no discoloration of the skin noted on the ears. No external obstruction, no discharge noted. I'm going to use the otoscope to examine the inside of your ear, okay? Tympanic membrane is pearly gray. Other mucous membranes inside the ear are light pink. No discharge, cone of light is visualized at 5 o'clock. No obstruction and no cerumen is noted within the ear, inner ear. We go ahead and clean the otoscope off with some alcohol. I'm going to examine the other ear. Any pain or tenderness on your ear?
No.
No ulceration, discoloration of color of the skin on the outside of the ear. No discharge or external obstruction noted. I'm going to go ahead and look inside your ear, okay?
Okay.
Visualizing the tympanic membrane. It is pearly gray. Mucous membranes inside the ear are light pink. Cone of light is at 7 o'clock. No obstructions noted, no discharge, and no cerumen noted. Okay. What did you say?
You took the swab or colder.
No, I don't want you to smell alcohol. I want you to smell the gum.
Mm.
It's if you smell peppermint, it's still
I
good.
mean the one that you've been used for
Yeah.
training
The hands. Yeah.
and sanitizer.
Yeah, I need that too. So let's go ahead and go to nose. Go ahead and take a look inside your nose, okay?
Mm-hmm.
There's right near inside mucous membranes are pink, dry, no discharge, no ulcerations within the right nair. Left nair, no discharge, mucous membranes are light pink, no obstruction, no abnormalities in the nairs. So with the nose, go ahead and plug one nostril at a time and breathe in and out. Okay, how was that?
Good.
Any blockages felt?
No.
Okay, and then do the other nose, please. Good. Any problems breathing in and out through each nose at a time?
No.
No. Let's go ahead and I'm going to look inside your mouth now, okay?
Okay.
Go ahead and smile and frown. Cranial nerve number 7. Facial nerve is intact.
So,
Patient is wearing braces. No dental cavities noted. Gums are light pink and moist.
you always stay here on the side. Left side.
Your left.
You always stay on the left side.
Your left.
If possible. In my left. Yeah.
Okay.
So that
Let's see.
picture.
Okay. So open your mouth. Stick out your tongue. Say ah.
Ah.
Uvula rises and falls with saying ah. Tonsils are S1. Roof of the mouth is light pink and moist. Raise your tongue.
Ah.
Bed of the mouth is also light pink and moist. Go ahead and swallow and breathe normal. Gums are light pink. Open your mouth. Again, no dental cavities are noted. Okay, thank you. Still doing okay, miss?
Yes.
All right. I need to get a drink of water too.
Yeah. Okay.
Can you take a drink? I'm gonna watch as you swallow. Accessory cranial nerve number 9 and 10. Glossopharyngeal and vagus. Patient has no problem swallowing, no coughing or choking. Notice of those 9 and 10 cranial nerves, glossopharyngeal and vagus are intact. Trachea is midline with no deviation. No masses or bulges noted on the neck. It is symmetric. I'm going to put my hands behind your neck. I feel like I'm choking you, but I'm palpating the thyroid. Any way you could swallow?
I'm just kidding.
Swallow. Symmetric swallowing noted with no masses or bulges on either side of the neck. Let's go ahead and do some other tests for the ears. Plug your right ear. I'm going to whisper something and you repeat it if you hear it.
99. Hello.
Okay, you passed the whisper test on the left side. Let's try the right.
Goodbye. Good night.
Good. Just passed it on the right as well. Next is called the Renate test. I activate the tuning fork and place it on the back of your mask leg process. And then when you hear the chime, you say, I hear it. And then I move it closer to your ear and you say, you hear it.
Okay.
And then you will tell me which one's louder.
Okay.
Okay, ready?
I hear it. I hear it.
Which one's louder?
The second one.
Good. Do the same with your other. Ready?
Yes. I hear it. I hear it.
Okay, which one will be louder?
The second one.
Okay. So the Renee test is passed because air is greater than bone conduction. So next is the Weber test. I activate the tuning fork, place it on the center of your head. You listen carefully from left to right and tell me if you hear it louder on the left or right, or is it equal?
Okay. You can see it.
One, two.
I hear it.
Okay,
Equal.
equal to the Weber test. So cranial nerve number 8, vestibulocochlear, is intact. Go ahead and shrug your shoulders against my hands. And then turn your head to the left against my hand. And turn your head to the right against my hand. Cranial nerve number 11, spinal accessory, is intact. And for cranial nerve number 12, hypoglossal, stick out your tongue, side to side, move it side to side. Cranial nerve number 12 is intact. Okay, very good. How you doing? Still good?
Yeah. I'm so big.
Compared to me, look.
I feel big. I feel big.
Me too, look at me.
See?
I look like a walrus. All right.
Sorry.
No, it's good. So we're going to go ahead and move to the posterior thorax exam. Posterior thorax is symmetrical. Going to lift up your.
You're gonna remove this later.
Yeah, because I need to see the skin and everything. Okay. Okay. So
See,
no,
it's very obvious now. It's more big.
no wounds, rashes, or lesions noted on the posterior thorax. It is symmetric. The skin is appropriate to raise. Go ahead and take a deep breath in. Okay, breathe normal. Expansion is equal on the left and right. It is symmetrical. Next test, I'm going to ask you to, on the next breath, to blow all the air out and hold it. All the air out and hold it. Okay. Now take a deep breath in and hold it, please. Okay, go ahead and exhale. Breathe normal. Diaphragmatic excursion is approximately 4 centimeters, which is a normal finding. Let me go ahead and percuss the other posterior thorax. Okay.
Did you put the trash can outside?
Yeah.
Thank you. Sorry.
While I'm back here, I'm going to test for CVA tenderness. I'm going to put my fist against your back and strike it with my other hand. You tell me if you have any pain or tenderness, okay?
Okay.
Any pain or tenderness there?
No.
Okay. So negative for CVA tenderness. This test, I'm going to test for tactile fremitus. So I'm going to put my hands in various places of your back. You tell me, you just say the word 99 and repeat it, okay?
Okay. 99. 99. 99. 99, 99.
Okay, Fremitus is symmetric from left to right.
Why not 100?
That's just what we do.
Oh.
99. I'm gonna go ahead and listen to breath sounds, lung sounds on your back. Every time you feel the diaphragm of the stethoscope feel a different place on your back, try to take a deep breath in and out, okay?
Okay.
A minimum of 8 areas. Good. Breath sounds are clear through all lung fields, and no adventitious breath sounds are noted. Okay, let's go to the anterior thorax now, the front. So the AP diameter is 1 to 2, which is a normal finding. The respiratory rate is 16 breaths a minute. Take a deep breath in and out. Chest rise and fall is symmetrical from left to right. Skin is appropriate to race. Tenting, turgor is good with no tenting. No wounds, rashes, or lesions noted other than the nevi that I already assessed. I'm going to go ahead and percuss the anterior thorax and lateral. Any pain or tenderness
No.
on your back or front where I touched you?
No.
Spine, back, sides, chest, no tenderness, right?
No.
Okay. I'm going to do the tactile fremitus again. So when I put my hands like this, you just say 99 for me.
99, 99, 99, 99.
Okay. Fremitus is equal from left to right. Now I'm going to listen to the heart sounds first with the diaphragm, and then with the bell of the stethoscope assessing for any bruise. So I'm going to listen here. The aortic valve location, 1 full minute. Pulmonic valve location for 1 full minute. Erb's point. Tricuspid valve. And the mitral valve. Then I'm going to listen to the same place with the bell, the stethoscope assessing for any bruise. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Also with the bell of the stethoscope, I'm going to assess for any carotid bruise, which is negative for any bruise. Would you mind turning your head to the left? No jugular venous distension. And then to the right, please. No jugular venous distension on the left either. So now I need you to please lay down flat. Assessing for any heaves or lifts. None are noted. I'm going to palpate for any thrills. None are noted. And I'm going to palpate the point of maximum impulse. With the patient laying down, I'm going to again auscultate the heart sounds and the key locations, first with the diaphragm and then the bell of the stethoscope, a minute each. So the aortic, pulmonic, Erb's point, tricuspid, and mitral. Then with the bell, aortic, pulmonic, Erb's point, tricuspid, and mitral. Time is it?
11:30.
Let me just check my email in case she emailed me something, okay?
Okay.
Okay, not yet. Now we're going to go ahead and go to the abdominal portion of the exam. Are you still doing well?
Yes.
Lift up your shirt.
Yes.
So the abdomen is flat, symmetric. Skin is appropriate to race. No rashes, lesions, or wounds are noted. No jaundice, cyanosis, or arrhythmia. No visible pulsations or visible masses are noted. I'm going to go ahead and listen to the brow sounds. Minimum of 2 areas per quadrant. Vowel sounds are active in all 4 quadrants. I'm going to use the bell of the stethoscope to assess for any bruits. So I'm going to assess for any bruits in the aortic, any renal bruits. Right is negative for a renal bruit, left is negative for a renal bruit. Iliac right, iliac left, and the femoral. No bruits noted. How often do you do a self-breast exam?
1 or 2 times a month.
Okay. The process should be raise the arm that the same side breast is on, start at the nipple, massaging in a circular motion going outward until you reach the axillary area, and you're looking for any lumps, bumps, or masses that you palpate. And during the shower is fine, and a minimum of once a month is also fine. And for males, I would teach the testicular self-exam again in the shower once a month to massage and examine the testes and the scrotum to ensure there's no mysterious lumps, bumps, or masses felt. In the abdomen, I'm going to start with some light palpation. Any pain where I'm touching?
No.
Going to go with deep palpation. Any pain?
No.
The right lower quadrant, deep palpation. If the patient had pain, it would be a positive McBurney's point. And then the Murphy sign is the right upper quadrant. I'll palpate the right upper quadrant and ask the patient to take a deep breath and then out. Any pain?
No.
No pain on inspiration, so it's a negative Murphy sign. I'm going to go ahead and palpate the quadrants of the abdomen, 2 areas minimum per quadrant. I'm going to palpate for liver span. Liver span is approximately 7 centimeters. I'm going to palpate for the spleen. Percuss for the spleen. Now I'm going to palpate for the liver. Take a deep breath in and out. Okay, and then in and out again, please. Palpate for the spleen. And the kidneys, in and out again if you would. Right kidney unpalpable. Left kidney. Unpalpable. Is there any pain or tenderness where I touched you there?
No.
Good. I'm going to assess some other areas here. I'm going to the femoral pulse. On the right is patent, on the left is patent, the inguinal lymph nodes. Popliteal pulse on the right, popliteal pulse on the left, dorsalis pedis on the left, dorsalis pedis on the right, posterior tibial on the right, posterior tibial on the left. All patent and intact. Let's go ahead and stand or sit up on the side of the bed, please.
Okay.
This is going to move on to the upper extremities. Any pain in the shoulders,
No.
arms,
No.
elbows,
No.
forearms,
No.
wrists,
No.
hands or fingers? No pain?
No.
No pain noted, no joint swelling, no discoloration of the skin. Skin is appropriate to race, no bruising, wounds, lesions, or rashes, and no edema. I'm going to go ahead and assess for the pulses. So this is the brachial pulse, radial, and ulnar. Brachial, radial, and ulnar. All patent. Going to do the deep tendon reflexes. So the left brachioradialis. Let's go ahead and relax your arm like so. I'm going to tap you and elicit a reflex response, okay?
Okay.
Positive on the left, brachioradialis. And on the right. Positive on the right, brachioradialis.
I didn't really push me while I'm laying away.
Yeah, because you're supposed to do the upper first.
Okay.
Upper extremities first. I thought about that too. So the brachial reflex is positive on the right, and then the triceps, deep tendon reflex. Totally relax your arm. Yep, positive on the right. Good. Deep tendon reflex to brachial. Go ahead and relax your arm totally. There you go. Yep, positive on the left. And the triceps deep tendon reflex. Ready?
Mm-hmm.
Positive on the left.
Mabunog lang. Yung pasyente, bunog na.
Let's go ahead and do this. This is the range of motion assessment of the upper extremities. You just follow what I do, okay?
Okay.
So the shoulder, we're going to flex the shoulder. We're going to extend the shoulder. We're going to abduct the shoulders. Adduct the shoulders. Then externally rotate. Internally rotate. Now the elbows. Flexion, extension. This is supination, and this is pronation. Okay. Now the wrist, flexion, extension, radial deviation, ulnar deviation. Fingers, flex, extend, abduct, adduct. I'm going to test your strength, so go ahead and shrug against my hands. And then now I'm going to pull back and you pull my hands toward your body. Okay, strong, 5 out of 5. Now push, yeah. Now push down at the wrist. Okay, and now pull up at the wrist. Push down with your wrist. Now push up with your wrist. Okay. Upper extremities measured at 5 out of 5 strength. Now let's do the Fallon sign. Put your hands together like so for 1 full minute. After the full minute is done, if the patient notices numbness in the thumb, index finger, or middle finger, that will be a positive Fallon test. Do you have any numbness or tingling?
No.
Okay. Now, next is the 10L sign. I'm going to percuss up to the medial nerve. Any numbness or tingling in the thumb, index finger, or middle finger?
No.
So it's a negative 10L sign. Do the same thing with this arm. Any numbness or tingling?
No.
It's a negative 10L sign bilaterally.
What do I have 15 minutes more? I need a break. I need to pee.
All right, go ahead.
I need to get the alcohol.
Can you get alcohol in a glass of water?
Okay.
Please. Boy.
Ay, akong sugo, akong tuman.
Sige, sige.
Akong sugo, akong tuman.
Sige, sige.
You want to bring this stuff? Let's leave it.
Just leave it there.
So with the lower extremities, left hip, flexion, extension, abduction, adduction, external rotation, internal rotation. The knee, flex, extend, ankle, flex, extend, internal rotation, external rotation. Toes, flex, extend, abduction, adduction. Lumbar spine, flex, extend, rotation, side bending. Thoracic spine, put your hands across your chest, squeeze your shoulder blades together, and then pull them back to pinch your shoulder blades. So that's the thoracic expansion, left and right, twist, and then the cervical spine. Look all the way up, all the way down, then to the side, turn your head. It's a cervical rotation.
Is that right? Is that right?
Thank you all for watching. That's a wrap. Wish me luck.